And then also secondary frozen shoulder. So I'm going to throw the floor over to Mr. Datani, who sees quite a lot of these particular types. Mr. Datani, what do you find in terms of those who have had surgery, but also those who've had an accident and develop a secondary frozen shoulder?
Yeah, thanks, Jeff. So in terms of post-surgical, it's thought that about 5% of people who undergo shoulder surgery of any kind, if it's a keyhole surgery or to repair the labrum, then about 5% of those will probably get a frozen shoulder. And that's why I tend to consent patients for any kind of shoulder arthroscopy procedures. I said there's about 5% chance of getting a frozen shoulder. And that's a sort of post sort of surgical because you've had an inflammatory response and the patient's sort of immune system has reacted to that particular insult to the body, and that's what's caused the post-surgical frozen shoulder. In terms of post-traumatic frozen shoulder, again, that's very common. It's not necessarily after a fracture, but it's after an injury. Someone's had a fall, either landed directly onto their shoulder or onto their back, or just wrenched their shoulder, and they're fine at that time. And over a period of the next 2 to 3 months, have developed a frozen shoulder. We sometimes also see these after sort of skiing injuries where people have had a fall and have developed, sustained what's called a greater tuberosity fracture, which is not always obvious on an X-ray, but is subsequently picked up on either a CT or an MRI scan. And the treatment for that is non-operative, where they go into a sling, but it's quite often, some of these patients will then go on to develop a frozen shoulder. So it's another sort of secondary cause of a frozen shoulder.